John, man, it is good to have you back with your voice.
Hey, my voice is here, man. Yeah. It's like I'm like a total different person. I felt like I was dying a couple of weeks ago, and now my voice is back.
I feel like I got somebody new in the office. I did one last week with Stuart, and I referenced that you weren't going to be able to be there because of your voice, and I said he'll be back, and so it's good to have you back today. Right now we're Medicare, and we talk about it a lot. That's the focus of what's going on. However, it seems like the ACA is starting to ramp up because people are seeing the deadlines. So I want to spend a little bit of time this morning talking about what everybody's calling about. Hey, I got a letter and my renewal rate is out the roof. So explain a little bit about why that's happening.
Well, first of all, we've got a couple situations for 2026. Everybody remembers COVID. With COVID, they had extended the subsidies. They extended them in the main means of more people got more money, and a larger economic demographic got more money as well. So people that made more money got a subsidy. People that made less money got a larger subsidy. So that was one thing that is actually expiring December 31st this year. So some of those extra funds that were being given out to help people with their premiums is no longer. It's going to be reduced substantially, and some people are losing it altogether. Yeah. So be sure to reach out to us or to somebody that you're doing business with to update your numbers. A lot of the letters that are coming out from the insurance carriers, they're not accurate. I'm showing like 3 or 4 different sets of numbers, depending on if it's a letter from Blue Cross or whoever, Ambetter, and then maybe I'm going on the healthcare.gov website, I'm going on our platform, and they're all showing different subsidy amounts or different total premium amounts, and we just need you to reach out to us so we can run your numbers, update your application, and make sure that they're accurate, because it's confusing. You get 3 or 4 different numbers, you don't know what's right, and technically we don't either until we actually throw it through the system again and update and make sure your income's correct and you didn't get a divorce, maybe you had a couple kids. We don't know what you did last year or this year or any changes that are being made if you're working or not working. So please call us so we can update those applications for you and get an accurate quote for you. Another thing that's going on, not only are the subsidies being reduced, the cost of insurance has gone up, and this is no exaggeration. It's like 40%.
I noticed that.
So if you had a plan that was $450 a month, and it's going up to like $700. That's happening to everybody. So some folks are getting a double whammy. Their insurance cost is going up, they're losing their subsidy, and now they're just stuck with this huge monthly bill. If that's your case, we do have some other options, some short-term policies that work pretty good. It's a nice replacement for healthy folks that can qualify with some underwriting, where we can knock that premium down of the full price down to about half price. But this is for mainly more high-income earners that are healthy. It's not for everybody.
Because it's underwritten, correct?
Yeah, it's underwritten. They ask health questions. But with that being said, because the insurance company knows you're healthy, they can charge you less because they know you're not going to be really using it. So That's a great plan for healthy folks that are a little bit on the higher income earning spectrum.
Yeah, what's crazy, right now we know where that number, that kind of line in the sand is about 84,000.
Right, correct.
So if I'm correct, if you make 84 or less, you can get a subsidy. If you make above 84, there's no subsidy.
And this is for a married couple of two. And if you're single, that number is more around 60,000. So those are some not set in stone numbers, but it'll kind of give you some guidance on could I still get a subsidy? Well, if you're single and you're making under 60, give us a holler. And if you're making under 84.5 as a married couple, give us a shout. Now, those numbers, remember, they do climb with more dependents in the house. So if it's a husband and wife with 4 kids, they get a much larger subsidy than just a husband and a wife.
Yeah. In past years, when we'd ask somebody about their projected income, they were kind of blasé about it. And like, I don't know, 85, 86, 87, 90. But, I had an experience this morning where I was on with somebody and they were throwing a number out that was close to that 84. And I'm like, let's really think about it. What is that number really? And let me explain the difference. Because this past year, their premium was about $237. It was a couple in their 50s. Then by losing that subsidy, if they went to 88, which is what number she gave me, possibly.
Right.
I was like, well, you don't get a subsidy and your premium grew to $2,100, which was, she's like, what? And I'm like, yeah, because you have no subsidy. And not only did that plan that you had last year's not even available, so it was going to go up anyway, but the fact that you have no subsidy, it just drives that cost through the roof. And I said, so think about your number and figure out, based on your deductions and whatever you have, what is the number really going to be? And unfortunately for her, it was not going to come down. So, we don't want anybody to misrepresent their number for sure, but really think about what that number is, because it definitely can make a huge impact on what you're going to pay. So, people were used to, like you said, people that were making $100,000 still getting a subsidy.
Right. Even $150,000, they were still getting a little subsidy for a married couple.
It's really drawing it back in, and I don't see it changing. Do you?
Man, I pray that it does. The government's up and running. I don't know if that had anything to do with this, but I know that was a hot topic of the insurance being really unaffordable next year. So hopefully, I pray that these numbers do change.
Yeah.
Because it's really going to stick some people bad in a bad situation for sure.
Yeah.
Now, Michael and I, we are not financial advisors by any means, but we can talk you through how the income works for next year. So let's say you're retired and you got a couple Social Security checks and y'all are used to pulling out so much out of a retirement account. Well, if you're going to pull out $8,000 out of your retirement account and it's $2,000 over that income limit and it's going to cost you $9,000, we can kind of tell you, hey, let's just take out $6,000 and then save that money that you would be paying extra. So we can kind of give you some guidance on, hey, do this, do that. Talk to your CPA, your financial advisor, see if this could work. You can even, some people are taking out money this year that they need for next year if they're already above the limits or whatnot. So there's a few different ideas that we have that we can share with you to keep you under that threshold. Yeah,
because there's a lot of people. I mean, they're saying, I don't think I said this, but there's 4 million people without insurance next year. More.
For extra, more. Yeah.
So that's a lot. And I think it's because people look at it and say, well, yeah, I need insurance, but I don't have the money to pay for it.
Right.
So they choose to do that. Now, when somebody is projecting their income, this always gets a little, not confusing, but you got to really understand it. If you're a W-2 employee, there's not a whole lot you can do on deductions. But if you have a company and you own a company and you have deductions you can take to get your income down, talk to us a little bit about how that can play into it.
So obviously we're a small business owner. We deal with quite a few business owners. There's several deductions that people that I don't even know if it crosses their mind. A lot of folks, they're just not educated in that arena, and maybe they do their own taxes and they don't have that professional guidance. But you can write off lots of things, anything from uniforms, from gas mileage, from insurance premiums, from depreciation. There's several things that small business owners can write off, and it does help drive that adjusted gross income down.
Yeah.
So that's another thing we could kind of help guide you and print out a list of stuff and make sure when you're doing your taxes, you're getting that down. Now, I do understand, and Michael does too, as a small business owner, you don't really know what you're going to make next year. It's hard to do, especially if you're in sales. A real estate agent, for instance, look at what that's done in the last 10 years. 1 year they're killing it. The next year they can't sell a house to anybody. It's the interest rate shot up and was just kind of stagnant. So it's very difficult for them to kind of guess what they think they're going to make. And we get that, but we always like to shoot a little above. But we also want you to use all the tools and use all the rules and write off as much as you can to get your income down.
Yeah, definitely get with your CPA or whoever's doing your taxes and figure out how you can get that number down so you can afford your insurance. Talk a little bit about, when you project your number, but it actually ends up being higher or lower, and you realize this mid-year, what kind of action can you take to mitigate the impact?
All right, so let's say you tell us, you call, hey, John, need some health insurance, got your number from so-and-so, and we start looking up your doctor's meds, and I ask you your income, and you tell me it's going to be 60. Well, then all of a sudden, you're about to do your taxes, or maybe you realize in the middle of the year next year, you're only going to make 50, or you're going to make 80. Okay, there's something that happens there. Whenever you realize that mid-year, I can go in and adjust your income for the rest of the year. That way, whenever you do your taxes in 2026, or in this case, it'd be 2027, for the 2026 tax year, you're not having to pay back an astonishing amount of money. It'd just be half of what you would be paying if you didn't tell me the entire year. We can kind of stop the bleeding mid-year.
Yeah.
Now, if you tell me it's 50 and you actually, you told me 60 and you actually made 50, so you quoted me more than you actually made. You made less. You didn't have a great year. When you do your taxes and it gets reconciled, you're going to get a refund. So you actually get money back from the government because you overstated your income and you actually made less.
Yeah.
So it's kind of a sliding scale, but remember, it's not, there is a cliff there. There's that cutoff at 84.5 and then you get nothing. It used to be kind of stair-stepped to where it'd be like 650, then 600 and all the way down to zero. Now it's like 650. And then 85,000, you get a $0 subsidy.
Yeah.
So it's a little shocking, to be honest with you, that it looks that way, but that's just the way the calculation is right now, the algorithm.
Yeah. How do we deal with people that have adult children that are living with them, but maybe they're on their own? Basically, they're in the household, but they're not supporting them. They're not claiming on their taxes. They're not supporting them financially other than living in the home. So how does that work?
Yeah, so if you have let's say a 25-year-old grandchild, he's working, she's working, maybe they're in school part-time, but you don't claim them, they're just independent, but they live at your house, they're not technically part of your household. A household is people that's claimed on your taxes, not people living in your house. Kind of like 4 college roommates. They're not all in the same household, right? They're just roommates, and that's kind of how it is. The grandson would be a roommate to the grandmother. She's just doing him a favor, giving him a room to live in, but he would be able to qualify for his own health insurance, his own subsidies based on his own income. And we help out with that often, especially if you have a child that's making 26 and they're being forced off of the parents' group insurance. That's another area where we can help out for sure.
Yeah, the one thing to be careful about, though, is when that homeowner or that household is claiming household members, they cannot count that grandchild in their calculations. So, just like you wouldn't want to count them because of maybe their income. You can't count them as a advantage to you to be able to use that when you're calculating your premiums. Correct?
Right. And another thing, if you are claiming your children and let's say they're in college and they have a part-time job, if they're making an income, you do have to include that on the household income. It's the father, the mother, and whoever else is on that insurance policy. You have to put all those numbers on there. Don't forget about that because it really can nip you in the bud later on when you're doing your taxes for not realizing that that does count as income for your household.
Right. Good. So, we understand that it's important for people that are dealing with ACA. A lot of them will get the letter from the carrier about, here's your new rate, go ahead and renew, renew. But I think it's always better if they give somebody a call, whether it's us or some other advisor, just to double check the plans, because they're renewing the plan you had, if available, or the next best option. But that may not be the option best for you at the time, because we got to look at, deductibles, network changes. So there's a lot of reasons to give us a call, even though you got that renewal letter, because we don't just let our clients renew. We check every one of them to make sure we can't make their situation a little better. So you want to make sure to reach out to us or whoever you need to reach out to say, hey, I got my letter. What do you think about this? It doesn't cost you anything to check on it. So give us a call. Now, John mentioned earlier, we do offer other health insurance. We have a couple different options that are either some short-term medical. There's a couple other carriers that are offering what they call, major medical plans, but they're not using, they're basically a defined network, and some of them are indemnity where they have limits on care. But there's a lot of different options depending on what you need. Like I said, if you're a healthy adult and you don't go to the doctor much, we may be able to find you an option where there's not, it's way less expense for you. So definitely reach out to us. Our number is 225-408-4100. Give us a call and let us help you. Even if you're not a client now, let us see if we can kind of make you a client and prove that we can make your situation a little better.
That's right.
Good. Thank you, John.
Yeah, man. Great conversation.
Hope you enjoyed our discussion today on Plus 65 Digital. Reach out to us at info@plus65advisors.com or give us a call at 225-408-4100. Make Plus 65 Advisors part of your Medicare process.